Our strategic sourcing efforts are based not only on price but on quality aspects. If you look at the changes in the reimbursement structure going forward through healthcare reform, we're no longer being paid for volume, but we're being paid for quality. Utilizing our physician integration approach to contracting, we're leveraging our intellectual property and our knowledge base from a talented group of surgeons that are helping design the strategies around contracting to meet those quality measures. To assist us in managing the cost of physician preference items like high-cost implants, our strategic opportunity has been to align ourselves with the quality measures that have come forward through our physician leadership. That doesn't always mean that we contract with every single vendor out there, but we contract for what's the best product delivers the highest quality of care back to the patient. Therefore, the vendor is gaining market share by limited participation from its competition, but gives them the opportunity to gain more market share amongst providers, and therefore allows them to offer the cost of the implant at a lower price point.
I think many of the healthcare providers that VHA works with struggle in the physician preference space. And traditionally, we see 20 to 30% of a healthcare organization's supply chain cost is in those physician preference products. But traditional sourcing tactics, such as trying to leverage for price, don't necessarily work in that field because it is subjective, and you have to understand the proper utilization of the products, and it does get into, by definition, it's very much influenced by physicians. You have to have the right processes in place, including health technology assessment and physician involvement in the contracting efforts, the sourcing efforts. And that's something that, frankly, many of VHA members have some struggle with.
Physician acceptance in the contracting strategies can often be viewed as a challenge. Cleveland Clinic has worked together with their physician leadership in educating them not only around the strategic sourcing opportunities, but actually the cost of healthcare and the impacts of healthcare economics. Therefore, there's much more buy-in up front as we go through these strategy approaches, is understanding what the contracting methodology means to the bottom line for the Cleveland Clinic as far as staying viable within this challenging environment. So therefore, we do education programs with our physicians, but in turn, they become a key member at the table when we're discussing the strategies and how we're going about reducing vendors, but again, providing the highest quality of care to our patients, which is always first.
And I think Alan hit a key point. When dealing with physicians, quality is paramount. So once again, a traditional sourcing approach of just looking at price and driving for the lowest price product doesn't work in this space, because physicians want to know how this is going to affect the quality of care that they're providing. So involving physicians up front in the process and having them feel engaged, that they help make the decision, is crucial to getting their buy-in and their acceptance of the solution when the contract is done.
Since 2006, we have initiated a strategic sourcing department that leverages the knowledge base of our physicians. And through the change in our culture, we focus a lot more on price reductions based on those quality measures. Again, this not being an easy process, once viewed as a business type decision making as far as reducing costs, now it becomes a means of responding to the changes in the healthcare environment. At one time, it was viewed as supply chain was forcing business decisions down our throats, and now it is viewed as a partnership. And in fact, as we walk down the hallways in the hospital, we have physician leadership who are constantly asking, what's that next project you need me on? I understand how important it is, and they have complete buy-in to what we've accomplished over several years. But again, not an easy process to work through, but again, since 2006, we've made tremendous headway with our physician leadership and great support from our executive team at C-suite level.
So Alan is describing what I see as a missing link in many healthcare organizations. It is just the process to engage physicians and have that buy-in on the front end. And as he described, in many organizations, the supply chain leaders are viewed as, well, here comes another business process and another attempt to save money, but without it really truly engaging us in the decision-making process. So to have that physician engagement is key to driving success in these difficult physician preference initiatives. Once again, many healthcare organizations don't have that.